This is All India Radio. In the program Spotlight, now we bring a discussion on e-Sanjeevani, a revolution in the health sector. The participants are Dr. Sanjay Sood, Project Director, e-Sanjeevani, and Arjun J. Chaudhary, AIR Correspondent.
I'm joined by Dr. Sanjay Sood, who is the Project Director of e-Sanjeevani at CDAC. And today we will discuss on the program on the success of e-Sanjeevani and why it's a revolution in the health sector. More specifically, the importance of telemedicine in our lives and how important it is for this to succeed in the future as well to cater to the medical needs of our population. Dr. Sood, for the benefit of our listeners, do tell us about e-Sanjeevani and its importance in relationship to telemedicine.
Thank you, Arjun. e-Sanjeevani is the country's national telemedicine service, which is conceptualized and made available by the Ministry of Health and Family Welfare and is operational in all the states and union territories of the country. And the objective of e-Sanjeevani is to increase access to healthcare services, enhance health equity, and also further the agenda of Government of India towards universal health coverage.
So how does it work? How does one access it in terms of getting consultation and then treatment as well online by means of this telemedicine? What is the procedure? How is it practiced? This is for the benefit of the common man who is tuning into this program.
Yeah, e-Sanjeevani is available in two variants. The first variant is called e-Sanjeevani ABHWC, which is operational at almost all the health and wellness centers in the country across all the states and union territories. And this particular variant is called doctor-to-doctor or provider-to-provider telemedicine platform, wherein the application or the telemedicine service enables the populace in the rural areas to get connected to the doctors or access health services without having to visit the hospitals or tertiary level hospitals or district hospitals. That is well within their village or the nearest health and wellness centers. And the other variant is e-Sanjeevani OPD, which is called patient-to-doctor telemedicine platform or patient-to-provider telemedicine platform. And this particular model enables the citizens to connect with the doctor or consult doctors in the confines of their homes by downloading e-Sanjeevani OPD application in their smartphones or accessing e-Sanjeevani OPD web applications through laptops and computers.
So what is the nature of the illness that one can use telemedicine more effectively, especially the doctor-to-patient OPD? How does one explain their symptoms and get a diagnosis? And is that enough? Does one have to follow up on this in terms of the physical interaction and the testing done and even surgery if required?
Sanjeevani OPD enables first OPD consultations as well, and it also facilitates follow-up consultations in case the patient has already had a consultation and wishes to seek another consultation. That is also feasible, and it can also support in terms of pre-operative or post-operative care. And we are working towards getting more and more tertiary level hospitals on board, like all the institutions on board, which are tertiary level institutions, so that when the patient gets treated there, goes back to his home or her home, they can then follow up with the same doctor or specialist without having to travel back to the hospital. So e-Sanjeevani OPD enables or facilitates all types of consultations, and the patient doesn't need to visit hospital unless and until the doctor calls for the patient or the patient is to be admitted or some procedure is to be performed.
What are the costs involved for using this app only for consultation and then, if required, to follow up on the consultation with an on-site visit?
As such, e-Sanjeevani services or services available on e-Sanjeevani are concerned, they are absolutely free. Patients can just log into Sanjeevani and as per the availability of the specialist, get connected with the doctor through the online OPDs. So there is absolutely no cost for patients to see a doctor through e-Sanjeevani.
But the follow-up would involve a cost for the patient concerned?
Yes, in case the patient is to visit, then it will certainly be a traditional or conventional visit to the hospital. The costs will have to be borne out of pocket.
You mentioned about the hospitals which are on panel. How are you linking them up, and how are the doctors available to provide teleconsultation in terms of the man hours? How are the resources being organized for making this app successful?
We've left the assignment of doctors on eSanjeevani OPD entirely to the hospital administration. So depending upon the requirements or depending upon the load that the specialty is getting on in OPDs, so depending upon that load, they decide that which OPD or which specialty will be open on how many days for how many hours. So depends, and we have institutions like Lady Hardinge Medical College and NIMHANS, Bangalore, and then AIIMS, various AIIMS like AIIMS Rishikesh, AIIMS Bathinda, AIIMS BB Nagar, Bilaspur, and even AIIMS New Delhi is working towards getting on board eSanjeevani. So all these tertiary level hospitals are also now getting on board eSanjeevani, and we are also working towards having Telemanas, which is the national telemental health initiative of Government of India, will also be using eSanjeevani platform for video consultations between the patients and the mental health specialists or practitioners.
So is the cost borne by the hospital itself when it provides teleconsultation online on this app, or is the government actually subsidizing this cost incurred by the hospitals which are extending resources for telemedicine?
As far as the IT infra or the platform is concerned, Ministry of Health and Family Welfare is funding the entire initiative. And as regards the resources, medical experts or specialists, these resources are being drawn from the states or the hospital's existing pool, wherein they are required to devote certain part of their duty on eSanjeevani. So this is not an additional cost in hospitals. They are using more or less the resources which they already have. It's just like opening another channel for connecting with the patients as a virtual OPD or as an online OPD.
So Dr. Sood, we discussed about the patient-to-doctor consultation online along with the OPD benefits to the patient who is seeking consultation from the doctor concerned. You mentioned about the doctor-to-doctor consultation as well. How does that work? Is it between a generalist versus a specialist? Is that how it is working? How is the benefit being leveraged?
Actually, eSanjeevani Ayushman Bharat Health and Wellness Centers is the variant which is operational as the doctor-to-doctor or provider-to-provider telemedicine platform, and it is acting as the cornerstone for the world's largest health insurance scheme owned by a government, that is Ayushman Bharat scheme. At all the health and wellness centers in the country, eSanjeevani Ayushman Bharat Health and Wellness Centers have been implemented at almost all the health and wellness centers across country. And health and wellness centers normally are providing services. Each health and wellness center is providing services to a populace of around 5,000 people. And whenever the patients, especially HWCs are located in the rural areas, so whenever anybody in the rural areas wishes to seek health services, then they visit health and wellness centers, and the community health officer facilitates a consultation between the patient and the associated hub where the specialists or the super specialists are located. So they speak with the patient or they consult with the specialist, and that is how this model operates. That the rural populace now does not need to or do not need to rather visit hospitals and seek health services. They can just go to the nearest health and wellness center and get the consultation with a specialist or a super specialist there itself.
Dr. Sood, is eSanjeevani linked to health insurance in any which way in terms of the patient also then accessing testing benefits and medicine from the over-the-counter as well?
eSanjeevani consultations are honored by the system within Ayushman Bharat scheme. That means the prescriptions generated here in the doctor-to-doctor variant, they do get honored for all sorts of treatments on Ayushman Bharat, health insurance scheme. As far as the patient-to-doctor model is concerned and other private insurance companies are concerned, yet this part is to be done, and it depends on the private insurance service providers if and when they would start sort of honoring or recognizing these costs or bearing these costs for tests, etc., whatever are prescribed using eSanjeevani's prescriptions.
Dr. Sood, what is the coverage of the e-Sanjeevani right now in terms of the territory? In India is concerned, how many states and UTs have been covered so far, and what is the future implementation of this plan?
E-Sanjeevani is available or has been implemented in all the states and union territories. The island territories like Andaman, Nicobar Islands, Lakshadweep, etc., they are also using e-Sanjeevani. And as far as the future is concerned, based on the directions from Ministry of Health and Family Welfare, we at Center for Development of Advanced Computing, we are providing to them the requirements, providing to them the features and functionalities as they are requested. Like the Ministry of Health and Family Welfare wanted a multilingual interface for in 11 languages. We've put that together. And similarly, the Ministry of Health and Family Welfare wants now to scale up the utilization of e-Sanjeevani from a teleconsultation platform to a telediagnosis, to enable telediagnosis as well. So we are working towards integrating lots of medical devices, or we can say point-of-care testing devices with e-Sanjeevani, which will enable the seamless transfer of test results which are conducted in the villages or health and wellness centers to reach the doctors, and then doctors can make much more accurate or a quicker diagnosis based on the information or the reports, results they receive. So these are the kind of innovations and enhancements those are being carried out on e-Sanjeevani on regular basis.
Is there any type of education module on instructing patients as to the nature of their illness or treatment once it's diagnosed, or to some extent been explained in the consultation as a follow-up?
Yet we do not have specific modules pertaining to medical conditions, but during the consultations, doctors do educate patients about various aspects which the patients must know while managing the medical condition.
What are the figures in terms of patient involvement under e-Sanjeevani? Could you give us a number?
E-Sanjeevani on daily basis is serving over 300,000 or 3 lakh patients, and it has served over 5.1 lakh patients in a day. And in all, e-Sanjeevani recently completed over 10 crore consultations, and it is getting more and more bigger. And we are working towards the capacities where e-Sanjeevani would be in a position to serve over 10 lakh patients every day.
So what's the IT infrastructure to serve such a large volume of people who are seeking medical help on this telemedicine platform?
e-Sanjeevani is a cloud-based telemedicine platform which has been developed using cutting-edge technologies and has incorporated artificial intelligence and machine learning algorithms as well in e-Sanjeevani. And this not only empowers the patients and the practitioners, but also ensures that it is capable of serving just about any load patients that reaches out for seeking care on e-Sanjeevani.
Dr. Sood, finally, if a listener on this program tunes into the e-Sanjeevani app, what are the initial requirements? Obviously, you have to give your details, but is an appointment date and time given for the consultation, or is it an immediate delivery of service?
As per the directions from MOHFW, we've mimicked the traditional hospital-based OPD in the system. The patient logs into e-Sanjeevani OPD and then selects the specific OPD in which the patient would want to see a doctor, and then raises a request. And as soon as the request is raised, the patient or the citizen gets into the waiting queue, and as per the waiting number or queue number, the patient's turn subsequently, depending upon the number of doctors who are serving that particular OPD.
Well, thank you so much, Dr. Sanjay Sood, for being with us on All India Radio and explaining to us the details of this successful e-Sanjeevani app, which is serving so many people in the country and alleviating the pain and suffering in the health sector.
Thank you so much, Arjun. And I would like to include here that e-Sanjeevani, by the courtesy of all the practitioners, administrators, policymakers at the central ministry and all the health departments in the country, e-Sanjeevani has shaped into the world's largest telemedicine platform, and we are continuing to make it even bigger. Thank you, Arjun.
You were listening to a discussion on e-Sanjeevani, a revolution in the health sector. The participants were Dr. Sanjay Sood, Project Director, e-Sanjeevani, and Arjun J. Chaudhary, AIR correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. You may email opinion about this program at airnsdtalks@gmail.com.